Thank you. So we've been talking about the 3 phases, and now we're going to talk about debriefing. So I'm going to talk about how to deliver feedback and debriefing. My goal here is to promote the incorporation of effective feedback and debriefing techniques into the surgical training so that we improve patient safety and outcomes by helping residents learn how to do cases and to be better team members. I have 3 objectives for this short part of the talk. One is to review the key characteristics of effective feedback and debriefing. The other one is to compare and contrast the difference between feedback and debriefing, because they are not the same, and discuss debriefing techniques and some challenges you might face with debriefing. But before we start, I know this is after lunch and it's a Friday, so a little riddle for everybody. I have 3 pictures there. I've got a picture of a chemical reaction there in the lower right corner, Lamborghini in the upper right corner, and then on the left-hand side, some debriefing. So what do you think these 3 things have in common? Sir? Say that one more time. They happen fast, yes. Why do they happen fast? Sometimes they happen too fast, but what helps make a chemical reaction go fast? A catalyst. They all have catalysts to accelerate the process of, in the case of debriefing, accelerate the process of learning. So what is the catalyst for debriefing? I'll show you that in a second. But first we're going to talk a little bit about feedback and giving feedback. And the thing to learn about feedback is that it's not debriefing. Feedback is not debriefing. So does anybody know what this is a picture of, besides Jim Korndorfer? All right, Jim, why don't you tell them? Mardi Gras Indians. These are Mardi Gras Indians. They come out during Mardi Gras. They spend a whole year creating their very elaborate and beautiful costumes. But the reason why I put these 2 things up is these are Indians, but they're different. One's a chief and one's a spy boy, and they're in the same group, but they're different. And that's the way you should think about feedback and debriefing. It's a continuum. Feedback is at one end and debriefing is at the other. So let's talk a little bit about effective debriefing. How do you give effective debriefing? Well, the best practices, or as what you call gold standard, would be feedback should be specific, it should be transparent, it should be given in a timely manner, it should be unbiased, ongoing, consistent in its character, and actionable. So what does that all mean? That means you want to hit the objectives, so that's why goal setting is so important that Amy had talked about, and that you want to do it in a timely fashion, and you want to base it on objective findings and not make it personal, and give people actionable items with which to do something. So let's go on to debriefing, and this is the catalyst for debriefing, a scenario. And in my opinion, the scenario is the catalyst, and debriefing is where the learning occurs. That's where you have your learning. And I think there are 3 key elements to doing an effective debrief. One is to create a safe learning environment. And I'm a simple country surgeon, so I just have very simple phrases to help me remember. And one is to make it safe. The other one is you want to encourage reflective practice. And in my thought process, that's making it stick, making whatever you're trying to teach stick. And then finally, you want to be able to elicit some sort of commitment to change. And again, that's trying to make it last. This learning event lasts by having them commit. So let's talk a little bit about these 3 key steps. One is making it safe. So how do you do that? You have to create an atmosphere of trust. And that means you have to create what we call psychological safety. So the person has to feel that they are able to talk and say what they think without any retribution or without any being mocked or anything like that. So you have to respect the learner as a debriefer. The other thing you have to do is you have to maintain a supportive climate. So you want to focus on the process, not on the person, and you want to keep it a dignified environment. And the pre-brief, again, going back to what Amy said, the pre-brief sets the tone, and it's very important. And even the pre-brief can serve as part of the debrief in the making it safe. The other thing you want to do is make it stick. So how do you do that? How do you make people kind of get to their learning points, identify their gaps? One is you encourage the reflective practice. So you encourage awareness of what the gap is, and you have them start to analyze and synthesize it. The other thing is you really want to focus on your learning objectives, going back again to the importance of setting objectives, because that's going to guide what type of feedback you might give, that specific aspect, and it will also guide any didactics you might have to incorporate into your debrief. Finally, you want to use objective indicators, i.e. you want to be able to refer back to objective findings within the scenario as opposed to subjective findings in order to help them accept the fact, oh yeah, I was slow on the uptake there, or I didn't intubate in a timely fashion, that sort of thing. Then you want to make it last. Well, how do you do that? You want to link objectives to everyday activities. So you problem solve, and you say, well, how does this correlate to what you're doing in clinical practice? You ask, how can you improve the care through this? And then you want to elicit participant involvement. So you want to get the participant to identify their gaps and commit to change. And I usually have them commit to one thing. So if you look at, debriefing can be divided into an introduction, the actual debriefing kind of process itself, and its closure. And if you look at that, each one of these things is emphasized more in a specific aspect. And you can see that through this table. So there are lots of debriefing techniques out there. And so I'm going to show you a couple pictures here. I want you guys just to yell out if you think you can figure out what type of debriefing technique this is. And the idea is it doesn't really matter the technique. It's just being consistent and hitting kind of those points I talked about. So what do you think this one is? It's advocacy inquiry. How about this one? Plus delta. How about this one? Stop and go. Stop and go debriefing is a time where you stop the actual process, you kind of do some targeted teaching and come back. But these are all very well established debriefing techniques. I'm going to focus on the plus delta because I think that is probably the simplest one to use. The plus delta is you go over like what went well, you have them reflect, talk about it, and then you say, well, what could you change? The delta, the Greek delta, Dimitri would be familiar with that, in the aspect of it. So how would you go about changing it, or what could have been better? There are lots of challenges as faculty members here. There are lots of challenges for us in debriefing, right? We're pulled in a billion different directions. We have time pressures. We have to go to the clinic. We have to go to the OR. We have emergencies we have to deal with. We have to go to meetings. We're supposed to be doing our research. We're supposed to be publishing. So there are lots of pressures. So there's some tools out there, surgical tools that we can use in surgery for debriefing. And there are two in the literature that I'll refer you to. One is the SHARP tool, which is an acronym that stands for what's there. And it's basically a way to do a quick, targeted debrief after an event, after an OR, where you've already set the objectives and then you asked how it went. And you're trying to get their feelings out of that so they can kind of decompress a little bit. And then you address concerns, and that is kind of the what went well, what could have been better. You hit the learning points you want to do, and then you plan ahead, i.e. you give them something to take home. And that's really emphasized, and I think that's a wonderful part of this LabCo TT technique, which is the set, which is the pre-brief we talked about, the dialogue, which Brian hit, and the closure. And the closure is the same thing, this kind of, how do you feel? How do you think it went? What do you think, trying to elicit out of the learner himself what he thinks the key points are, kind of guide him that way if it's a little different than what you think. It also leads into insight if they don't match. And then have them have a take-home point, a take-home message, one thing that they can work on. So if you look at the safe, making it safe, stick, and last, you can see that there are various components. This didn't, unfortunately, this moved around with the change in the slides. But the set objectives and how did it go is kind of a safe aspect. Addressing concerns and reviewing learning points is stick, and the lasting aspect is planning ahead, whereas the set is more safe, and the dialogue, the closure is the aspect where we were just talking. So in summary, let's talk a little bit about feedback and debriefing. So what's feedback? Well, I'm going to use a metaphor. Feedback is like a cat. What's a cat like? It doesn't respond to you. It's a unilateral relationship. You've got to be really specific. That's what feedback is on the continuum. debriefing's like a dog. Debriefing is a dog, if I'm using a metaphor, right? So a dog is it's a bilateral relationship. You're getting responses, and the dog, you can reflects on what you're doing and tries to interact with it. So it's a continuum, but it's good to know kind of, sometimes you need to do that feedback. You need to do that unilateral specific stuff. Other times it's very useful to play with your dog, right? To do bilateral reflective debriefing. So I thank you very much, and we'll move on.